Such a section of the head and neck. So you have here the nasal cavity. Okay, and this is the roof. The roof is made up of nasal, frontal, ethmoid, sphenoid. And the roof of the nasal cavity is the floor of the cranial cavity. Okay? This is the floor of the nasal cavity, and this is the hard palate. Okay? The nasal cavity, you divide this into two. This is nasal vestibule, inside the ala, nasi, and is bounded by lumen nasi here. Okay? And here in the lateral wall, you have here three rolled up bones. Superior concha or turbinate, middle concha, inferior concha. Below and lateral to each, you have the meatuses. Superior meatus, middle, and inferior meatus. Sa inferior meatus, doon dumadaan ang naso-lacrimal duct. Okay? Now here, related with the nasal cavity, you have paranasal sinuses. This is frontal sinus, inside the frontal bone. Sphenoidal, inside your sphenoid. Ethmoid, itong superior concha na to, at saka middle concha, pag tinanggal nyo, makita nyo superior meatus, saka middle meatus. Pag tinanggal nyo yun, you find here air spaces. You call them ethmoidal sinuses. And there will be three of them. Anterior, tapos dito, middle, and then posterior. And then, you have here inside the maxilla, you have maxillary sinus. Lahat sila dito nagpupunta. Ano to? Middle meatus. Except this one here. What is this? Sphenoidal. Ito ay ethmoid bone, ito is sphenoid, nandito is sphenoethmoidal recess. At saka yung ethmoidal, posterior ethmoidal, dito sa, anong meatus to? Superior meatus. Pero lahat dito sa middle meatus. Sa inferior, ano dumadaan? Nasolacrimal duct. If you have nasal cavity here, this is nasopharynx. And here in the roof, you have pharyngeal tonsil. When they large, you call that adenoid. Here, in the lateral wall, you have here your opening of the Eustachian tube that connects this nasopharynx with middle ear or tympanic cavity. So, ibang pangalan niya, pharyngo-tympanic tube. Okay? Pharyngo-tympanic tube or auditory tube. So, you can equalize the pressure on either side of your tympanic membrane. Tapos, ito naman yung oral cavity. This is oral vestibule, this is oral cavity, upper. This is palato, glossal arch, palato, pharyngeal arch, and this is palatine, tonsils. This is your tongue. This is anterior 2/3, and this one is the posterior 1/3. You have lingual tonsil here. This is what? Palatine tonsil, that is pharyngeal tonsil. These are lymphatic tissue, and these are related with the immune system. From the genial, superior genial tubercle of the mandible, what is this? Genioglossus. This is hyoid, so this is what? Geniohyoid, and this is mylohyoid. Between the anterior 2/3 and the posterior 1/3 of the tongue, you have the foramen cecum. Okay, you have foramen cecum at the middle of the sulcus terminalis separating these two. And you have at the back of the tongue, this is your epiglottis. Next slide. Now here, you have the lateral view of your head and neck. Okay, and let's see some landmarks here. The one for closing, these are the muscles of facial expression. The one for closing the eyes, orbicularis oculi. For pursing the lips, pursing the lips, orbicularis oryx. For sniffing, nasalis. Okay? To elevate the upper lip and dilate your ala nasi here, levator labis superioris alapi nasi. For smiling, what do you have? Cymaticus major. For sarcastic smile? Risorius. For depressing the angle of the lips when you're sad? Depressor anguli oris. For depressing the lower lip,
Quadrangular.
depressor labii inferioris. Okay. Now here also, you find your temporalis fascia. So what did you do here? You just remove your skin, and these are structures that you find in superficial fascia. So sa ilalim nitong puting temporalis fascia, nandoon yung temporalis muscle. So this is not temporalis muscle. This is your parietal muscle. And this is part of the fronto-occipitalis muscle. Okay? Frontal belly of the and the occipital belly of your occipitofrontalis muscle. Okay? And you have here now your buccinator, right? Your buccinator. So this is the trumpeter's muscle. Now, all these muscles of facial expression are supplied by the nerve that is passing here in the parotid gland na wala dito, hindi nakikita. It divides into 5 terminal branches there. This one is the facial. But there is one muscle here not included in the facial expression. This is mastication. This one is your masseter that moves your mandible. Now here you have the parotid gland. Okay, the base up and the apex down, related with the angle of the mandible. And this is sternocleidomastoid, and this is trapezius. So you have posterior triangle of the neck. And you find here splenius capitis attached to the mastoid and superior nuchal line, and underneath you have between superior and inferior nuchal line semispinalis capitis. And this is now your levator scapulae. Okay. Dito, walang scalene posterior, anterior lang at saka medius. Now, this is supposed to be blue. This is a vein outside the sternocleidomastoid. This is external jugular vein. Okay? Now, if you have here the pinna, you have here superficial temporal artery coming from external carotid. External carotid ay yung artery na dumadaan sa loob ng parotid gland. So, tatlong importanteng structures ang nandoon. Most important structures will be facial. Another one, the artery, external carotid. The vein, posterior facial or retromandibular vein, because this one is anterior. This is anterior facial vein. This is what? Posterior or retromandibular. How is retromandibular vein formed? Union of the superficial temporal vein at saka vein doon sa loob, sa intertemporal. Internal maxillary. You form now here what? Retromandibular. And it has posterior division and anterior division. Posterior division joins with posterior auricular, dapat blue lahat to. They form here, dapat blue din to, external jugular vein. And this one opens into the subclavian vein. The anterior division, okay, of the retromandibular will join with this. What is this? Anterior fascia. You form here what? Common fascia. Nag-open dun sa vein inside, internal jugular vein. Ano tong blue na to? Dapat blue? External jugular vein. Okay, next. You have now here, okay, you have now here your orbicularis oris for pursing the lips. This is mentalis. Okay, so when you pout, okay, and you wrinkle the chin here, this is mentalis. And then this is your buccinator, the trumpeter's muscle, covered by your zygomaticus major, your minor. You have here a muscle underneath, and this is in the angle. This is corresponding to the depressor anguli oris. This one is levator anguli oris. Okay? And then you have here, this one is the rambus of the mandible, that's the angle. If they put some chalk here, what muscle is that? Masseter. In here, the cornoid, what muscle is that? Temporalis. And this is temporal fossa. Doon sa loob ay infratemporal fossa. If you see muscle na nakaganyan sa neck, what is that? Lateral pterygoid. And if you have muscle hanging vertically like that, okay, kaya lang nasa kabilang side, okay, what is that muscle? Medial pterygoid. Okay? So, these are muscles that will move your mandible. Okay? And you have now here, this one is external carotid, and one of the arteries is this one. This is the facial. Okay? So, you have here facial, you have submental, you have sublingual, you have here superior labial, you have here external nasal. Okay? And next, kasi pangit dito. Okay, next. You have now here a lateral view again. The parotid gland is partly dissected. Sa loob niya, dumadaan yung facial. Ang facial ay para gumalaw ang muscles of the face. So these are for the muscles of facial expression. Kasi ang masseter supplied ng trigeminal. Which nerve? Mandibular. Okay. And coming from external carotid na nasa loob ng parotid gland, this will be the superficial temporal artery and vein. And this nerve here, auriculotemporal nerve, coming from mandibular division of trigeminal. Okay. And you have, okay, you have now here sternocleidomastoid. The blue here is actually external tubular vein, and this white thing here are branches of cervical plexus. Okay, those branches of cervical plexus, C1 to C4, the only nerve, okay, that supplies motor, that has motor fibers going to the diaphragm will be phrenic, from C3, C4, and C5. This one is coming from C2, C3. Supplying the skin here. Kasi lahat ng skin dito, para makalandang trigeminal. Pero dito, greater auricular. Dito naman, sa lateral part ng occiput is lesser occipital. Okay. So these are branches of what you call cervical plexus. Next. Now here, you have now here the orbital cavity. And this is the framework of the upper eyelid and lower eyelid. Superior tarsal plate, inferior tarsal plate, attach the lateral to the orbital margin by means of lateral and medial palpebral ligament. And this is levator palpebrae superioris muscle. Ano gagawin niya? Opens the eye. And this one separates, divides your lacrimal gland into two, superficial and deep. That's a tendon of the levator palpebrae superioris. And then, okay, at the medial end of upper eyelid and lower eyelid, you have a puncture. Okay, and there is now your canaliculi going to, what is this? Lacrimal sac. And this is naso-lacrimal duct that you see opening in the inferior meatus of your nose. Okay, inferior meatus of your nose. Now you can see here buccinator, and there is a buccal pad of fat. And this is parotid, this is Stenson's duct. Ipipierce niya yung fat, yung baby fat, buccal pad of fat, and the buccinator to go to the oral vestibule at the level of the upper second molar tooth. Okay, next. 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 Okay. Here, you have now, okay, you have now here your left common carotid, okay, and this now at the level of thyroid cartilage, upper border, this now becomes from here going there, that is external carotid. Ito ay nasa loob ng parotid gland. And this is internal carotid that will go to the brain. If you have external carotid here, the first branch is going to the thyroid gland, superior thyroid. Next branch is there, passing underneath your hyoglossus. Okay, and that will be your And that will be your lingua.